Hello, welcome back to my channel. I am God. Thank you for clicking in. If you have not subscribed, please quickly subscribe. And before you go ahead with this video, help me to give it a thumbs up, like it, so that the video will be seen by so many other persons. And if you are a returning subscriber, like you have always been here, God bless you. Thank you for coming back. And grab something, sit down and relax. So today I am here to talk about other interventions that medicine has brought in just to help humans raise family outside natural conception. So today we are going to be looking at IUI. Of course, you know it's also anterior insemination, otherwise known as AI, that is artificial insemination. And what is artificial insemination, you may want to ask. And artificial insemination is the procedure where the sperm is directly injected into the uterine wall or the uterus or the womb, whichever way, with the help of a device called speculum via a catheter. So it is, the sperm is directly injected into the uterus. This procedure reduces the time and distance needed by the sperm to travel down to the egg in order to fertilize it. So that is what the procedure is. IVF is done outside the body, but this one is inside the body. IUI is normally a treatment for mild male factor infertility, and couples with explained infertility will undergo IUI. Also, anybody that will undergo IUI may also need medications to stimulate the ovary in order to produce more eggs. And of course, it's usually performed by a fertility specialist. So what is the time frame for IUI? IUI is a very simple and fast procedure, like I said earlier on. So the time frame is between 5 to 10 minutes. Within 5 to 10 minutes, one thing again with IUI is that the sperm is only injected into the uterus during the ovulation period. And when that is done, the natural course will take place. The body will, take it up from where it has begun. Additionally, IUI may not be a suitable treatment for the following circumstances. 1, if there is an issue of a blocked fallopian tube, IUI may not be the best treatment for a fallopian tube blockage. Has severe endometriosis. If there is a case of a severe endometriosis, IUI will not be the best treatment option. People who are in their late 30s or over 40s, IUI may not be the best way to go about raising a family. If people who have low quality of eggs, in that circumstance, it may not be okay. If people who also have low numbers of eggs, IUI may not also be the best treatment you should go for. So this treatment is also not suitable if the reason for infertility in the male is very severe. So in severe male factor infertility, IUI may not be the best treatment, just so you know. So what is the difference between IUI and IVF? There is more difference between IUI and IVF than similarities. So in IUI, the sperm is directly injected into the uterus during ovulation via a device known as speculum. Unlike the IVF, where the fertilization takes place outside the body in a test tube under an environmentally controlled chamber. So they are totally two different things. Okay, IUI procedure can be performed either with your partner's sperm or a donor sperm. in general, IUI does two major things. Number one being that medications taken before the IUI procedure helps to stimulate the growth of eggs, making the woman much more fertile. So she's able to produce more than one egg from each of the ovaries. That is number one. Then secondly, it increases the chance of getting pregnant. So there is high height of pregnancy occurring. These are the two major things that an IUI procedure will do. What is the step in IUI? During the IUI procedure, which normally takes few minutes, like I've mentioned, between 5 to 10 minutes, a fertility specialist, your doctor, of course you are dealing with a specialist. It is not done by, any kind of doctor. Okay, so the specialist will place that speculum, the device, inside the vagina and insert a small catheter through the cervix into the uterine cavity and inject the sperm. During the procedure, the patients will most likely not feel any discomfort. So, meaning to say that the procedure of IUI is 0 to 1% painful. So it is painless. Now, IUI is of two types, CI and the IVI. The ICI standing for intracervical insemination. In this procedure, the sperm is injected into the cervix via a small tube. So the sperm is injected into the cervical mucus. The IVI, which is the intravaginal insemination, the sperm is injected into the vagina directly, which most of the times people do it by themselves at home. Now, who needs IUI? Who are the people that will need IUI? The following people will need IUI procedure. 1, women who may not be ovulating, such as people that have PCOS or hypothalamic patients. The next is women with unexplained infertility. Then male partners with minor semen abnormalities or ejaculatory dysfunction. Anyone who also needs a donor sperm, such as the LGBT couples, heterosexual couples struggling with male factor, or single women who are looking to conceive. These are the set of people that will need an IUI procedure. How much does IUI procedure cost? IUI procedure is quite cheaper compared to the IVF procedure. The price ranges from $2,000 to $2,000 depending on the type of medications used and also the clinic where you are doing it. It doesn't have a specific amount because it will differ from clinic to clinic and based on the kind of procedure used. Preparing for an IUI cycle. So before the IUI procedure, you will need to do some testing to ensure that IUI is the right step for you. This is the same type of testing that women who will undergo IVF will normally go through. This testing helps your doctor to understand your fertility more. Okay? You have hormones regulating your ovarian reserve as well as a genetic blood work to ascertain whether you are a carrier of any kind of disease. The sperm you will also be using whether it's from your partner or from a donor, will also undergo analysis. You will have a HSG test to ascertain if your fallopian tubes are open or blocked, so that they will ensure that when the sperm is being injected, your fallopian tube is well enough to permit the sperm to pass through it. And if all of these tests are done and everything appears to be good, you will be scheduled for an IUI. And 2 to 3 days before that procedure will be carried out properly, you'll be advised to abstain from sexual activities before that procedure will be carried out. So the best time for IUI procedure will be during your ovulation. If you are not ovulating regularly, your doctor may prescribe medications to induce ovulation, because IUI depends largely on your natural ovulation. Women who undergo IUI also usually have to have their ovaries stimulated beforehand to mature eggs and take a trigger shot to release one egg. Then the sperm being used must be prepared before the insemination will actually take place. The stimulation process can take about 10 days. Women who choose not to have stimulation before IUI just follow their natural ovulation period. Or take an injection to induce ovulation and have IUI done after. What are the chances of having twins or triplets with IUI? Yes, if you are taking ovary stimulating medications before your IUI procedure. Because these medications tells your body to mature as many follicles as possible, there is greater chance that when it ovulates, your body releases more than one egg, and a woman can become pregnant with twins. Although this happens 10 to 20% of cases involving IUI. How can IUI cycle help to improve my chances of pregnancy? How IUI can help improve your chances of getting pregnant? Since the sperm is placed directly into the uterus, thereby reducing the time and distance that the sperm will have to cover traveling to the egg to get fertilized. As a result of this, IUI bypasses problems that takes place in the vagina or cervix, such as incompatibility between sperm and cervical mucus. IUI also improves the delivery of the sperm to the egg, especially when the sperm count is low or the sperm do not move well. So you see, the chances are high. Will I need multiple IUI to become pregnant? Oh well, if a woman doesn't become pregnant after her first IUI, she can go over it again and again. But if after several trials, it is still not coming out well, then they will have the option of going for an IVF. That is after several cycles. So how soon will you know if the treatment was successful? Oh, you probably know. It will be very obvious. And about 2 weeks after your IUI, the first sign will be you missing your period. And a blood test will confirm that you are already pregnant. And once that happens, voila, the embryo will continue to develop in the uterus, even as your stomach or your bone continue to increase. And that is it. So considering the cost of IUI and IVF, how much will you spend for 3, 4, 5 IUI compared to one cycle of IVF is dependent upon you as a couple that is trying to raise a family. And I hope I have been able to give you what you need to know about IUI in a very short summary. And I will see you in my next video.